Alex. So my name's Faye, and I want to start by saying that we're at a really crucial point in this campaign, and it's so important that the process now remains driven by patients, because it's patients who've been living with prohibition, and we've got pretty good at treating ourselves. We know how to obtain our medicines, and quite frankly, if we don't have a system that delivers what we need, then the situation isn't going to change, and all of this would have been a waste. So my message to the policymakers in the room today is listen to the patients, because not listening to the patients has got us in this situation in the first place. About 6 years ago now, I was diagnosed with rheumatoid arthritis, which is an autoimmune disease, and it has lots of different drugs that the NHS can offer me. Unfortunately, I didn't have a very good time, and this is why. This is a list of things that might happen to a person who takes methotrexate, a drug that I was asked to take every week for the rest of my life in order to control my immune system. Cannabis does that, and it doesn't have all of these side effects. It's not going to destroy my liver, it's not going to give me cancer, it's not going to make my existing symptoms worse. My experience with this drug was such that after a couple of years of trying, and I did give it a fair go, I was facing the prospect of having to give up on work. I was facing the prospect of having to leave a 10-year career and change my lifestyle entirely, because my career had always been something that was very important to me. So the next one. So we also have naproxen, which is an anti-inflammatory, has some very similar issues, and my experience with naproxen was basically constant gastrointestinal distress, if you want the gory details. And then also there are painkillers which are addictive, cause more nausea and vomiting, dangerous for the heart, and basically the longer that you take these things, the more risk you become of experiencing some of these symptoms. So after about 2 years of this, I realised that I needed to try something new, because I was facing the end of my career. And I turned to cannabis. Cannabis is an anti-inflammatory, cannabis is an immune suppressant, and cannabis is a pain controller. So it now has actually been about 4 years since I touched a single pharmaceutical, so much as an ibuprofen. I have never had to stay in hospital because of my illness or because of related side effects, which getting to 5 years from diagnosis is actually quite uncommon for somebody with my illness. I take cannabis in lots of different ways, and I think it's something that is important to recognise the breadth of products that cannabis patients use. So I take cannabis oil every day, a 1-to-1 ratio, and I have a dosage that's in a capsule, and I know how much I'm taking. In addition to that, I might get some symptoms. It doesn't completely control my flare-ups. Neither did the methotrexate, so nothing's a foolproof solution, but with cannabis I manage. I manage so well that in fact I've now toppled off that 10-year career ladder, and I'm starting something entirely new on Monday, which I would never have had the confidence to do was I still in a haze of methotrexate and painkillers. I just wouldn't be able to do it. So I take cannabis as a tincture as well. I take edibles because they're discreet, and I also consume it in an inhaled form. Now, the reason that cannabis in an inhaled form is a medicine is that it's fast acting and it's easy to dose. So I know that there are some debates as to whether inhaled cannabis can ever be considered medicinal. Yes, it can, because if you're to a meeting that you're late for, and your feet suddenly go into spasm and you can't move, you can't sit down and wait for half an hour for that pill to take effect. You need to inhale something and it will take effect immediately, and the problem will be solved. So yes, that's really my story, and thank you for listening. I've gone way over 3 minutes, so I'm going to